topic is all about enteral tube feeding.
This video is a short explanation about the enteral feeding and will give you an idea about different routes of enteral feeding. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. Let's get into the session. The learning objectives we will be discussing in this video will be: what is enteral feeding? What are the indications of enteral feeding? What are the different routes of enteral tube feeding and its uses? And what are the nursing considerations? Let's get into the topic. Enteral feeding, also known as tube feeding, is a method of delivering nutrients directly into the gastrointestinal tract, which means delivering nutrients directly into the stomach, duodenum, or jejunum. It is particularly suitable for patients with a minimally functional gastrointestinal tract who are unable to consume sufficient nutrition orally. The picture given for your reference will help us to understand the different routes of enteral feeding. Here, the nasogastric tube in the stomach, called as nasogastric tube, orogastric tube in the stomach, called orogastric tube, and nasogastric tube end is duodenum and is called nasoduodenal tube, and nasogastric tube ends in jejunum, which is called nasojejunal tube. Gastrostomy is a surgical procedure in which a tube is inserted directly into the stomach through the abdominal wall. Jejunostomy is a surgical procedure in which a tube is inserted directly into the jejunum through the abdominal wall. Now coming to the indications of enteral feeding. The common indications of enteral feeding are: unconscious patients or those in a coma due to neurological disorders, critically ill patients requiring nutritional support, post-operative patients especially after head and neck surgery, dysphagia, that is difficulty swallowing or impaired swallowing function, esophageal obstruction and dysmotility impairing the passage of food, gastroparesis, that is delayed emptying of the stomach leading to inadequate digestion, various gastrointestinal disorders affecting nutrient absorption or digestion, malnutrition or undernutrition due to chronic illness, inadequate intake or metabolic disorders, oncological, trauma, and in burns, enteral feeding is commonly indicated, and so on. Now, coming to different routes of enteral feeding. There are different routes for administering enteral tube feeding. Let's discuss one by one. Enteral feeding via nasogastric tube. Indications of nasogastric tube. A nasogastric tube is a flexible tube inserted through the nostril, down the esophagus, and into the stomach. Uses includes temporary feeding for patients unable to swallow or consume adequate oral intake, administration of medications, fluids, or nutrition in patients with intact gastric function, gastric decompression in cases of gastric ileus or obstruction. Next is enteral feeding via orogastric tube. An orogastric tube is a flexible tube inserted through the mouth and into the stomach. Uses of orogastric tube. Orogastric tubes are typically used when nasogastric insertion is not feasible or tolerated. Similar to a nasogastric tube, it is used for temporary feeding, administering medications, fluids, as well as gastric decompression. Next is enteral feeding via nasoduodenal tube. A nasoduodenal tube is a flexible tube inserted through the nostril, down the esophagus, and into the duodenum, which is the first part of the small intestine. It is inserted in the same manner as that of nasogastric tube, but is allowed to pass into the duodenum, usually with assistance either endoscopic or radiological. Uses of nasoduodenal tube. It is used for delivery of enteral nutrition directly into the duodenum to bypass the pylorus and stomach. It also prevents aspiration in patients with delayed gastric emptying. It is used in case of gastric stasis, post-pyloric gastric stasis, which refers to a condition characterized by delayed emptying of the stomach contents into the small intestine, also called as post-pyloric. Next comes enteral feeding via nasojejunal tube. A nasojejunal tube is a flexible tube inserted through the nostril down the esophagus and into the jejunum, that is the middle part of the small intestine. It is usually inserted endoscopically or radiologically to ensure that they are in the correct position in the jejunum. Uses: it is same as that of nasoduodenal tube. Nasojejunal tubes are preferred when delivery of nutrition beyond the stomach is required, such as in case of severe gastric motility disorders or aspiration risks. Next comes enteral feeding via gastrostomy. Gastrostomy is a surgical procedure that creates a stoma that is opening in the abdominal wall. The stoma allows for the insertion of a feeding tube directly into the stomach, and this can be placed endoscopically, radiologically, or surgically. Uses: this is recommended if feeding is required for longer than 4 to 6 weeks, providing long-term enteral nutrition to patients unable to swallow or eat adequately, administering medications directly into the stomach. It also facilitates hydration in patients with swallowing difficulties, and it supports patients with neurological disorders or head and neck cancer, etc. Next is enteral feeding via jejunostomy. Jejunostomy is a surgical procedure by which a tube is inserted in the lumen of the proximal jejunum primarily to administer nutrition. Uses includes same as that of gastrostomy, like providing long-term enteral nutrition, administering medication, and facilitating hydration. Now comes nursing considerations for enteral feeding. Assessment: regularly assess the patient's nutritional status, including weight, hydration, and signs of malnutrition. Next is tube placement. Ensure correct placement of the feeding tube by verifying the tube position using appropriate methods such as pH testing or X-rays. Tube patency. Check the patency of the feeding tube by flushing with water before and after each feeding or medication administration to prevent blockages. Skin care. Maintain the skin integrity around the tube insertion site by keeping the area clean, dry, and free from irritation or pressure. Positioning. Position the patient appropriately during and after feeding to prevent aspiration, reflux, or complications related to tube placement. Feeding rate. Monitor the rate of feeding to ensure that it is appropriate for the patient's tolerance and nutritional needs, adjusting as necessary. Medication administration. Administer medications separately from enteral feedings whenever possible to prevent interactions or interruptions in feeding. Monitoring. Regularly monitor the patients for signs of complications such as abdominal distension, nausea, vomiting, diarrhea, or tube dislodgement. Patient education. Provide education to the patient and caregivers on proper feeding techniques, signs of complications, and the importance of regular follow-up care. Documentation. Maintain accurate records of enteral feeding intake, output, tube care, and any observations or interventions related to the feeding regimen. So far we have discussed what is enteral feeding, what are the indications of enteral feeding, different routes of enteral tube feeding and its uses, and what are the nursing considerations. If you find this video useful, please like it, share it, and subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.